In this video, we will explain the anatomy of the hip bone. More specifically, we will talk about the composition of the hip bone and the important features and bony landmarks found on it. The hip bone is a large, irregular bone that forms the skeletal component of the pelvis. It connects the axial skeleton to the lower limbs. The two hip bones articulate with the sacrum at the sacroiliac joints and join each other anteriorly at the pubic symphysis to form the pelvic girdle. Each hip bone is composed of three parts: the ilium, highlighted in purple, the pubis, appearing in yellow, and the ischium, seen here in pink. On the right side, you see the lateral view of the hip bone, and on the left, you see the medial view. Before puberty, the three parts of the bone are separated by cartilages. But by the end of puberty, they become fused, forming a cup-shaped socket known as the acetabulum. The acetabulum articulates with the head of the femur to form the hip joint. You can check our video on the acetabulum and hip joint for more information. Now, let's talk about each part of the hip bone in more detail. What I'm going to do here is isolate the right hip bone to see its bony landmarks better. We'll start with the ilium, which is the uppermost and widest part of the hip bone. Here we are looking at the medial aspect of the right hip bone. The ilium has an anterior medial surface and a posterolateral or gluteal surface. It consists of two parts: the body, appearing in pink, and the wing or ala, which is highlighted in yellow. These parts are separated by the arcuate line. The arcuate line runs inferiorly until it reaches the posterior part of the iliopubic ramus, where the ilium meets the pubis. The iliac crest is the superior border of the ilium, and it runs from the anterior superior iliac spine to the posterior superior iliac spine. Below are the anterior inferior iliac spine and the posterior inferior iliac spine, which are also bony projections located inferior to the anterior superior and posterior superior iliac spines, respectively. The ilium has a large notch known as the greater sciatic notch. The iliac tubercle lies about 5 centimeters behind the anterior superior spine. The medial surface of the ilium is concave and forms the iliac fossa. The surface provides a site for the attachment of iliacus. More posteriorly is the iliac tuberosity, which is an elevated and rough area that serves as the attachment site for the ligaments of the sacroiliac joints. Inferior to the iliac tuberosity is the auricular surface, which is covered by hyaline cartilage. This surface articulates with a similar surface on the corresponding side of the sacrum. The gluteal surface of the ilium provides an attachment site for the gluteal muscles. Moving on to the pubis. The pubis is the ventral part of the hip bone and it consists of 3 parts: the body, the superior ramus, and the inferior ramus. The body is the largest part and it forms the medial portion of the bone. It is attached to its contralateral fellow at the pubic symphysis. The pubic crest is the rounded upper border of the body that overhangs the anterior surface, and its lateral end is the rounded pubic tubercle. Both crest and tubercle can be palpated. The superior pubic ramus articulates with the ilium and ischium at the acetabulum, and it forms the upper border of the obturator foramen. The pectineal line is a ridge that forms the anterior part of the pelvic brim. The inferior ramus of the pubic bone is connected to the inferior ramus of the ischium inferiorly. Finally, let's look at the infero-posterior part of the hip bone. That is also the strongest part, the ischium. As with the pubis, the ischium has a body and 2 rami. The body contains a bony prominence known as the ischial spine. Below the spine is a lesser sciatic notch that becomes a foramen by the sacrospinous and sacrotuberous ligaments. The superior ramus projects inferiorly and posteriorly from the body, and it possesses a large swelling known as the ischial tuberosity. The ischial tuberosity is the attachment site for muscles of the lower limb, and it plays a role in supporting the body while seated. The inferior ramus of the ischium is attached to the inferior ramus of the pubic bone.